Welcome to This Just In, the show bringing you the latest advancements in healthcare, strategy, innovation, and public policy. And now, for the fastest voice in healthcare, here's your host, Justin Barnes.
Welcome to the special episode of This Just In Radio. We're broadcasting live from ViVE 2023 in Nashville. First, I want to thank CHIME and DHI for inviting us to their theater. I'm your host, Justin Barnes. We have a terrific show this morning with a great lineup of thought leaders from the industry. Our theme for the next hour will be focusing on priorities and challenging of today's hospital CIOs. My first guest needs no introduction and is a revered guest of the show, Steve Lieber, Chief Analytics Officer, Digital Health Insights, CHIME. How are you, my friend?
I'm doing good, Justin. It's great to see you again.
It's always great to be on air with you. I tell everybody this story. I'm going to continue to tell it for the rest of my time, but you're the reason this show exists. We've been doing it 10 years, but you're my very first guest back in the Venture Forum, 2015 in HIMSS in Chicago. So it started there. You helped me kick it all off. I'm grateful for the opportunity, grateful for your friendship through now almost 20 years.
I was going to say, the story goes back farther than that, doesn't it?
It does. But again, welcome to stage. Great to have you here. So first of all, tell me how, the show's been so far for you. Last couple of days, been busy. You've been here for a few days.
It's been fantastic, Justin. There's an evolution that you go through with events, and this is only year 2 of ViVE, and it's already well down the path of evolution. We learned a lot last year in Miami Beach, brought that learning into Nashville. We've got over 7,600 people here, which is just about a 50% increase. Now, I'm going to say, though, we're going to cap it. We're not going to let it keep growing.
Okay.
We're kind of toying around with the idea of this thing should peak out at 10,000. Right. And so it's possible next year in Los Angeles.
Love it.
Looking forward to it. It's possible that people might not be able to get in because we're going to hold to that. There's a benefit in size, both benefit of big size as well as more manageable. And what we sort of concluded at this event is it's an exclusive audience, very high level, and we want to maintain that and maintain to a degree an intimacy. Now, how intimate is 10,000 people? Still a lot of people. But now the layout here in Nashville, and it'll be repeated in Los Angeles, creates very easy access to a whole lot of activities. We brought the content down on the floor. So we've got these huge stages in all the corners here. So there's only one place to go. Down here, and you can eat. I'm looking across the floor here, the puppy park over there.
Exactly.
You've got really fantastic content in the theaters, and then we've got 600 plus companies ranging from people that are truly wet behind the ears. I mean, they're just brand new to well-established, long-standing technology companies, and so it really has been a fantastic couple of days already, and just hearing the conversation and buzz, I think people are really responding very positively to the model that we've created.
They are. I've been here actually since last Wednesday, kind of getting ready, getting prepped, inviting people into town and just greeting them. And there's a great level of energy here. You guys are doing a phenomenal job. Second year, over 7,600 attendees, phenomenal. LA next year, February 25th, I believe it starts. So everybody starts to mark your calendar. Certainly if you're going to cap it. And I agree with the intimacy. You can meet anybody that you want here. You can walk around. I've almost met every single person that I wanted to, and I'll meet some more. I'll be here through tomorrow afternoon. So you've achieved that goal. Let's take a quick step back, though. People who may not know, how did ViVE come to life? And this is between health and CHIME. You guys came together. Why?
Yeah, well, health the health conference, it's in the fall, had been operating for probably about 3 years when we first started the conversation. And there's a little bit of history as well between me and some of the staff over there. They used to work for me when I worked at HIMSS. Yes. And so, you start to sit down and have conversations with folks and have worked with before. And it's like, well, what if? And what we saw at CHIME was a spirit in the health DNA in how they do conferences, and really liked the energy that they brought to their events. And they were focused more on the business investor side with health. And at the time, unfortunately, the relationship between HIMSS and CHIME was falling apart. And so CHIME was saying, okay, where should we play? We have a responsibility to drive education and professional development with our executive audience. And so it just sort of evolved into a natural partnership that leverages very different capabilities at health and at CHIME. And the combination of the two together is just really dynamic, as evident by what we see here.
For sure. So I guess bringing together this type of focus, these audiences, you guys, CHIME is traditionally focused on the CIO and that C-suite, and you're expanding that a little bit, obviously keeping it a great thought leader level with good strategy. So tell me how CHIME is helping CIOs today, specifically.
Yeah. Well, and I like to talk on both points about the traditional core audience of CHIME, the CIO, as well as the broader audience that we're doing under the DHX brand. One of the things that Russ Branzell, the CEO, and I know you've got him, I think, tomorrow morning, said, a strategic view he had was we need to go beyond our traditional audience. And so CHIME is very dedicated to that core audience. The boot camps and programs that CHIME produces are very targeted at the professional development of the current generation of CIOs and future generations. But beyond that, there is knowledge and learning that needs to extend to what is an ever-increasing number of executives that are involved in this area: digital officers, strategy officers, innovation officers, on and on. And so we said, all right, we got to protect the brand, got to protect CHIME. And so we're very focused on that audience. But let's go out and start to look more broadly at the executive levels that are in different places, that are users of technology, buyers of technology, and that sort. And that's what DHX evolved into. And so, now we've got an audience of about 300,000, which is a significant X over the 3,000 members of CHIME. But it just, I think, highlights the importance of being able to expand your reach in order to communicate a message, to be able to extend the learning opportunities. And, as someone famously said, I didn't realize healthcare could be so difficult. It is. And
it
so
is, absolutely.
And so having that broader audience and being able to learn from them. This is a two-way relationship. We're not just pushing stuff out. We're also reaching out and bringing content in from these other audiences, because in provider settings, you don't operate alone. We learned that a long time ago. It's not technology projects, it's enterprise projects, it's patient projects, that sort of thing. And there are multiple players involved. And you got to get everybody together to do it right.
I love it. Excellent. So we'll wrap up here tomorrow, and then you guys start thinking about next year. And so tell me about the fall coming up, and obviously it's just planning for ViVE in LA next year, early next year in February?
Well, as with both organizations, we both have our separate fall events. CHIME has its fall forum, which draws about 1,000 CIOs and related professionals to that event. And so, as we move from here, we head into not only that event, but we're also trying to be much more present all the time. And so having built the digital channels that we have, working with you folks in terms of developing and delivering content throughout the year.
Absolutely.
It's gotten a lot easier over the years to be able to stay connected. And so we're doing a lot more in the digital environment. And within, there'll be a few months where we won't be talking about Los Angeles, but it won't be that many, because it is, for an event like this to be successful, there's a long lead time on the planning.
There is. Absolutely. Steve Lieber, thank you so much for joining the show, my friend. Great to see you as always.
Thank you, Justin. It's my pleasure.
Thank you, man. Appreciate it. Awesome. Aneesh.
Hey there, buddy. You, Steve.
Good to see you as
well. Oh, great to hear your interview. That was really interesting stuff.
Thank you.
Thank you. Thanks
Good
for having me.
Good to see you.
All right, brother.
What's up, man? How you doing?
Excited.
Same here.
We're live. We're live.
We are live
We're
at
doing
ViVE.
live.
How are you, my friend?
I am excited. Eager to chat with you.
Amen.
You're the convener. The convener that brings the great conversations forward. Thanks for having me.
So Aneesh Chopra, President, CareJourney, good longtime friend, great friend of the show. First of all, how's ViVE been for you?
Oh, it's great. It's a chance to reconnect with old friends. But I view these events as an opportunity to call to action the private sector to move forward on issues that the government wants us to work on, but hasn't quite yin and the yang. We haven't quite got the final answer from the government, but we've got a direction. So we got to rally the troops, and all I need is a half a dozen early adopters, and we can make magic.
You got it, my friend. So for you, those who don't know, Aneesh, country's first CTO over a decade ago. You're obviously just mentioned a big advocate of public-private collaboration. So first, what are some of the things that you're focused on that you want to bring to bear and for all of us to know and see?
Well, listen, presidents make their key priorities known on day one. For President Obama, it was to create a more open and transparent and collaborative government. And that was the reason, in part, my office was created. President Biden made health equity his top priority, and on day one said, I want the industry, the whole agency and government and the country to move more towards understanding and therefore managing social needs. So I am here in part because there's a technology gap on how we identify individuals that are food insecure and housing insecure, because it's not a standardized data field in our regulation. So we need the industry to come together to standardize what it means to be of these social needs, and then how to work on ways to mitigate them. So we're working on a program called Sync for Social Needs, which is a public-private collaboration. I'm also working on ways that we can unlock the power of the Cures Act regulations into the EHR system. So I'm calling this the era of bulk fire networks. Perhaps we'll get into some of that. So yesterday's session with Micky to help bring people into the foray about what's possible. This is no longer an R&D experiment. We can go into production with 95% of the certified EHRs making the 12/31 deadline. So there are a couple of these public-private partnerships on the mind and a few more cooking in the oven.
Yep. So tell me about, what are your thoughts on the evolution of TEFCA, the fire pilot project and all that?
Okay, so this is a controversial question, and you teed me up in a way that I want to take a moment to peel the onion back.
Yes, please.
So it is both important but also unrelated. So we've created a framework with TEFCA to stitch together all of the networks that have been born on the treatment use case that interacted with health systems through the traditional document-based exchange model.
Yes.
So the verb of TEFCA is that you bring people together under a common agreement. But the noun of TEFCA, the requirement for IHE profiles and all of that, the noun is less useful. The verb is critical. So the question now, and this is the big debate that we were having over the week, is do I wait in sequence for the TEFCA networks to get their act together and launch on the current noun before we can get started on the future state? Or could we run in parallel? And I think Micky's call to action was very clear yesterday. We must move as quickly as possible for a TEFCA FIRE framework.
Yes.
And there is a TEFCA FIRE roadmap, but it's currently written to be sequential. Wait for us to get our stuff act together. I don't think it should be sequential. It should be parallel. So I expect to work on half a dozen bulk fire networks that are in the spirit of TEFCA, waiting for that bridge from whenever TEFCA connects the bridge from the legacy environment to the fire environment. So we'll have a pathway forward, but I think it's going to be a very interesting ride. There may be private networks that get launched first natively in fire before we go to the national networks.
So my show focuses a lot on best practices and like tangible next steps, actual next steps. If someone wants to learn more about that framework and how they can take action in that and make a difference, where do they go? Where should I point them to?
Well, I would say right now, when you read the TEFCA FIRE roadmap, which is published on the ONC website, for the nerds out there, that's me, it's stage 2, facilitated point-to-point exchange.
That's what I wanted.
And so if you read that technical design and stripped away all of the legacy nouns, you would say, what would I do today, MacGyver style, if I was given access to the bulk fire infrastructure on the plan and the provider side? I could actually connect a facilitated point-to-point network, and we're hoping to bring that up. We heard from Multicare yesterday that they're eager to move forward for a quality use case, and so we'll start to see more coalitions of the willing get going, and that will be the announcement. So we have Sync for Social Needs is named with about a dozen partners, Epic, Meditech, Cerner, and then we have a soon-to-be-announced series of bulk fire networks. And we'll hopefully do that in the coming weeks, if not months. But we'll get it done in calendar year 23.
Love it, love it. So a lot of CIOs here. What should they be thinking about when it comes to technology in the organization? There's a lot on their plates. We've had so many conversations the last couple of days, even here on stage. But what should CIOs be thinking about with their technology stack and their stack?
Here is the call to action. And if you can indulge me for a minute.
Please.
Their internal demand signal will largely reflect fee-for-service medicine priorities.
Yes.
And so they have to meet the mark of today's demand signal. The regulatory demand signal is a future for value-based care. And so the delicate balance for a CIO is, when do I move towards a future use case that's a demand signal for the industry, but may not be a demand signal at my institution?
That's right.
And can I have a team A, team B approach so that I'm ready and capable, so that the minute the business leaders flip to value-based and they're like, all of a sudden, we need to have a friendly, collaborative payer data sharing agreement, not an antagonistic, revenue cycle battle royale. You don't want to say, oh, that's a nice idea. I need 2 years to get my infrastructure ready to meet that use case. So this is a challenge for CIOs. Don't be the bad guy. Congress said No Surprises Act. We have to stop emergency, all this crappy surprise billing in emergency rooms. Yeah. What happened? The CIOs said, oh, I don't know how to do this. So we've delayed saving people from this scourge of surprise billing because IT couldn't get its act together. That's unacceptable, Justin. Not in your world, not in my world. So we got to be balanced and expect that the demand signal for the future will come.
Yep. No, actually, one of my investments, we actually navigated that successfully, but people couldn't implement it. I mean, they just weren't ready for it, but we built it so they could be ready, but I'm on the same page with you, my brother. Last question. Thinking about the crystal ball, the proverbial crystal ball, and you kind of touched on this a little bit, but I'll even push us a couple of years out even more. What do you see as a key strategy or trend that we got to navigate in 3 to 5 years from now? Like CIOs and health systems, even providers, need to be ready for.
All right. Here's my call to action.
Love it.
I see a new customer for the CIO community to serve inside their enterprise. That'll be a health information fiduciary. So there are parts of the organization that operate like BAAs. Mm-hmm. I want to extend my capability, add a digital front door, add this technical capability, etc. But it's largely on the incentives of the current system as it operates. But the health information fiduciary is almost decoupled from the legacy infrastructure. What you hear in the debate today is that, oh my goodness, the third-party apps, the consumer-designated apps, oh, they could be horrible, there's no HIPAA protections, it's bad, bad, bad. When those organizations that are attacking the consumer-designated apps don't realize, you're looking in the mirror, brother and sister, because you will be a consumer-designated app.
Got it.
You may not be a third-party app, but you're going to be a health information fiduciary that says to your customers, I will help you bring in your data outside of our enterprise and work with you to make sense of it. And my passion at CareJourney is that we will incorporate high-quality provider ratings so that you can route people to the best navigated point for their health status, almost independent of what your internal enterprise objectives might be. Health information fiduciaries could be disruptors coming out of the Silicon Valley ecosystem, but more likely than not, they're going to be extensions of the incumbents who got religion that they want to be advocates for people under a new digital Hippocratic oath. And CareJourney is here to support that enterprise because that's the market we need.
I love it. We never spend time on CareJourney. We've got 90 seconds. Tell me what's next for CareJourney.
Well, today was an exciting day for us. I'm on, call me the honorary chairman of the Glenn Tolman fan club. Right. We announced a partnership with Transcarent.
Love it.
We've been largely working on the risk-bearing networks, the Medicare risk-bearing networks, and getting into those that have commercial organization interests. It turns out that the quality analytics, who are the high-quality providers, is absolutely critical for improving the vision that Transcarent has laid out to help employees get to the best possible care at lowest possible cost and highest possible quality. Good thing, those are not all, they're all aligned in the objectives. So today we announced that Transcarent is going to partner with CareJourney to unlock our quality, open data quality engine for the benefit of their growing network of employers. So I think this is an opportunity to really help people make the best decisions at every single step of their care journey.
Congratulations. Love it. Love Glenn.
All right.
Excellent. Aneesh Chopra, thank you so much for joining me, my friend. Take care. Have a great rest of your conference.
All right. Have fun.
Thank you. Thank you. Awesome.
No, that was not for that.
Great job, sir.
Hi, Didi. Give you a hug.
No.
Been so long.
So long.
Good to see you.
So good
Thank
to
you.
see you as well.
Awesome. Didi Davis, Vice President Informatics and Conformance and Interoperability with Sequoia Project.
Yes.
So, before we dive in, tell us what Sequoia Project is. A lot of us know, but for everybody.
No, I'll try to keep it brief.
Love it.
The Sequoia Project's a not-for-profit for the public good organization based and headquartered in Washington, D.C. We think of ourselves as a convener of the healthcare sector in general, trying to reach consensus to have secure, interoperable exchange of information. And that could be any type of information, but also coupling that with the policy perspective so that you have the trust to have that exchange happening. The Sequoia Project is the recognized coordinating entity in collaboration as part of the cooperative grant with the Office of the National Coordinator. You'll hear more about that from Micky Tripathi.
Yes.
But we are the RCE since 2019. So we have been working a lot with the candidate QHINs, but we really try to do facilitation of that interoperability. So we have a lot of different initiatives. The most active is our Interoperability Matters initiative, and it covers things like data usability, things like public health, consumer engagement, those things that are important as well.
Yeah, and in full disclosure, I was a board member of Sequoia Project.
Yes.
Love Marianne Yeager.
Yes.
Is Marianne here?
No, she's not here. She sent her regrets. Okay. It just made sense. I live here in Tennessee, so it was one of those things that, driving here was very easy, but she was at the first ViVE.
Yes.
And she fully supports ViVE and so forth, but she sent me instead.
Cool. Well, I'm glad you're here.
Thank you.
Tell me a little bit about, some of the priorities for the Sequoia Project, but also, this is a personal passion for yours for many, many years.
You know me.
So, tell what the priorities and what should these CIOs be thinking about when it comes to interoperability and you obviously standards and obviously interoperating and working with Sequoia Project.
Perfect. And I think Aneesh said it really well. You need to make sure you're proactive, thinking about things that are going to flow down as requirements that are coming up. Today, with the exchange happening, healthcare CIOs need to be thinking about how does my data interoperate in the ecosystem. Mm-hmm. That ecosystem could involve long-term care, social determinants information, public health information, thinking very broadly about that. So I think that that's one thing I fully advise on. And of course, you know me, I've always preached the standards way of doing things, using healthcare standards so that we're not doing those point-to-point interfaces that continue having to be updated and it's not scalable. It costs too much money.
Breaking.
So think about the big picture and try to start as you acquire, especially as you do IT project updates. Think about how can I make this data more usable and complete? How do I exchange it with my partners? So thinking along those lines, I think that way you'll always kind of filter through and support, your whole patient journey for your patients that you take care of.
So, and love it, Didi. So if you're a CIO or, Chief Information Officer, Chief Interoperability Officer, what would be a few best practices that you would say, hey, you have a strategy, but this is where you really want to focus in on, and this is where, these standards or next steps or really tangible next steps for them?
You threw me a softball, and I don't know if that was on purpose, but thank you for doing that.
It's really important. I actually know the audience, and they need to hear these. So, yeah.
No, this is great. So my passion, and I've been doing this now for 3 years or so, data usability. So I think that's one thing. I kind of alluded to it, but I'll go into a bit more. So truly, the Sequoia Project in our mission for public good did release a version 1 implementation guide last December. And we're kind of working through now the process of making it take root, kind of playing on our Sequoia tree, infrastructure piece. So we are trying to make sure that the implementation guide has the care and feeding, socialization, communication to see, hey, this is guidance that's using industry standards. These things are actually required for the meaningful use, what it was, now promoting interoperability requirements and so forth. So there's guidance in there that's very pragmatic to do things like reducing duplicates of data, being able to do patient matching better, thinking about provenance, where did the data come from? So thinking about those things, there's real conformance items. This is a testable implementation guide, and we're going to be creating tools. So hoping to maybe have them start adopting that. We're doing the taking root movement, where we're kind of trying to say, let's have some, pathfinders find their path along the way. The trailblazers, they have to kind of cut the trail. They're the ones that maybe are going to be implementing more. And then the real groundbreakers, the one that actually get the momentum going. So I think, data usability, looking at that implementation guidance, since it is new, I would love for folks to join us in this, because it's going to be all of us. It takes everyone working together to get us to that next mark.
Absolutely. So if someone wants to engage that and they can join Sequoia Project, is there a work group you would point them towards, or what's next?
Great. Don't have to be a member of Sequoia Project. It is an open, inclusive. In fact, we've got 270 plus organizations that are members and 380 plus actual individual participants. So go to sequoiaproject.org. Under Initiatives tab, there's the data usability. Sign up, download the calendar invite. We meet once a month, the first Thursday of the month. Calls are for 1 hour, open for everyone. And if you sign up for the listserv, we'll push you, when we're having summit, for instance, we're going to have a data usability summit later this year, things like that are coming up. But we'd love to have, in fact, we've just released the last version 1 guide. We're already working on version 2. Because it took us 2 years to reach consensus to get to that first step.
Exactly.
And we want to make something that's going to keep us moving and implementable within an 18-month timeline. So
I love it. So obviously engagement, this is something that was very near and dear to my heart and even my education along the way, over the past 20 years. All these free resources, learning from your peers, engaging. This is very complex and very difficult.
Absolutely.
And so when you engage Sequoia Project or the interoperability initiatives, you get to learn along the way. You get to reprioritize what you're doing so you can kind of plug in to where healthcare is going.
Yes.
I think it's really important that people, take this as a first step, learn. Don't be intimidated by how complex this is, because all your peers, we're all in the same boat.
Exactly. Yeah. And we all need to row together to make this happen. The work we're doing for version 2, we're asking for those pain points between now and June. So Brain, is there something that's really difficult in your organization that we should consider and figure out a way to solve that?
Exactly.
Let's work together to do that.
Exactly. And again, your peers around you, part of these work groups, they are free consultants for you in a lot of ways. You're going to have questions. They'll actually help you get in there and row the boat with you in your organization.
Absolutely. Yeah. And I think the more we share, the more perspectives everyone has. And I think it actually opens up their eyes. We've been working on Lab. Lab is a very tangly mess, as we call it right now. So we're really trying to break down those barriers and some of that, because bringing the lab folks and the providers together, trying to make sure we're looking at it from the same viewfinder is.
So Lab is my new space. So
it is.
It is.
I didn't know that.
I did. Yeah. Well, I haven't told anybody yet.
Fresh news.
I know. So, let's talk about that for a second. I got an extra couple minutes here. So tell me about what are you guys doing when you say lab interoperability? What do you mean by that? What kind of standard specs? And then I want to know where I got to go.
Yeah. So I'm going to point to what Shield is doing. Shield is really helping promote this, and they're having discussions. There's meetings weekly and so forth. So what we did in the version 1 of our implementation guide was concentrated on like the top 200-ish labs that every kind of provider wants.
Okay.
Let's normalize those and let's get those codified so you can have semantic interoperability.
You got it.
We now need to start thinking this to the next step. So we're working with like Texas and California and others who are a little further along with this, but following Shield and the work that they're doing, as well as what HL7's doing. So there is some lab interoperability improvements that are happening. There's going to be some FHIR components that take in, but I'm happy to talk to you and meet later on today if you need. So
cool. Thank you so much. Didi Davis, so great to have you on stage. Thank you for joining us. Hope you have a great rest of your conference.
Thank you.
Give me another hug. It's been too long.
Absolutely.
Thank you,
I'll
sweetie.
take that.
It's good to see you. Thank you.
Safe travels.
Thank you very much. Didi Davis, Sequoia Project. Oh, and Micky, right on time. This is great.
I know.
Perfect timing, Micky.
Hey.
Good to see you, my friend.
You too.
Thank you. Excellent.
Happy to be here.
Great. So we obviously just finished with a great interoperability discussion with Didi and the Sequoia Project. Love what they're doing. Right before that was Aneesh, so we got a good energy boost as well as some good strategy and content.
Following Aneesh and Didi, that's tough.
It is. Well, Micky Tripathi, National Coordinator for Health IT at HHS. Great to have you back on air. First of all, how's the conference been so far?
It's been great. Really, really awesome.
You spoke this morning before here?
I did. I spoke this morning, was on a couple panels yesterday, but, a lot of energy and enthusiasm, which is awesome.
Yes.
And it's really a great venue.
It is. So Steve Lieber was my first guest. We opened the show together, and he mentioned that we're probably going to cap this ViVE at 10,000 to keep and bottle this energy.
Yep.
So we don't get too big and kind of just, we lose the quality. We want to maintain the quality and this interaction, the strategy, the engagement. So I think it's kind of cool. So you hit the nail on the head. So what did you talk about before you came up here? What was your main stage keynote discussion?
Just the usual health IT rigmarole. No, I talked about the, sort of the priority areas that ONC has. So, just overarching theme, we are pushing really, really hard.
Good.
We're pushing really hard to
We need that.
enable the industry to do what I think the industry wants to do, actually. When I've been out in the market and just working with stakeholders, there's so many organizations who actually want to do a set of things, but they feel like they're unilaterally disarming if they're the only ones who do it.
Right.
In a fragmented healthcare delivery system, that's really hard. And so in some ways, almost in a sort of perverse way, people are like, if someone would just tell us we need to do that, it'd be a lot easier
Right.
for certain things. I mean,
Right.
not everything.
Right.
So that's, we're pushing really, really hard. I'm pushing really, really hard to get everything done that we can get done in the, in the time that we have here. I break it out into 4 themes. Building the digital foundation. We've got electronic health records. There's still gaps. How do we complete that? Second, how do we make interoperability easier? All the things Didi was talking about, TEFCA, APIs. Third is, how do we motivate more information sharing, right? We can give people tools, but as we know, they may or may not use them.
Right.
And we can do more to encourage that with information blocking regulations. And then finally, how do we think about appropriate uses of data? Now that we're making more data available, you've got health equity, you've got algorithms, you've got very serious privacy considerations, following the Dobbs decision of the Supreme Court. All those things are really important areas for us to be thinking about.
Excellent. Love it. So with TEFCA moving along now, how and why should this be a priority for hospital CIOs? Because that's mainly the attendance here at ViVE. So what are your thoughts there?
Yeah. Do you want to be connected to other organizations?
Absolutely.
You want to build one interface that allows you to connect to, not everything, but more and more of what you need to do with other providers, with payers, with public health agencies? Or do you want to keep building bespoke interfaces, having a huge interface team that builds these brittle bespoke interfaces that don't get you on what you want to be able to do? And do you want an easy way to communicate to patients? We're connected to TEFCA. We're connected to the interoperability network that all of you want that's going to support better patient care. I think in a nutshell, that's what a hospital CIO ought to be thinking about.
Love it.
It's a frustration of too much interoperability, I think that we have in some cases where, they're thinking about, I got 10 different things and each of them is a different interface. Is that scalable? No.
So you just released the interoperability in methods of exchange among hospitals. What are some of the highlights from that, and what should a hospital be looking at in that regard?
Yeah, I mean, there's information sharing continues to grow as the data shows. Not surprisingly, we've spent $35 billion in federal health IT incentives, at least an equal amount on the private side, and that doesn't include the blood, sweat, and tears of the hospital administrators, the physicians, the nurses, everyone who's implementing those.
Didi.
So if we weren't seeing an uptick, I mean, you would almost have to, sort of consciously try not to do anything with those systems. But that said, we know there's still a lot more we can do. It's still not the natural instinct of most organizations to share information.
Right.
My mother broke her hip last August. And we brought her to a hospital. They're on a very good EHR system. Transferred her to a rehab hospital. They're on a very good EHR system. I won't name names, but they're very good EHR systems, let's just say. I know they're connected literally in front of me, as I pointed out to them. It's like, you guys are doing this right in front of me. They're printing out her record, handing it to us and saying, please bring it to the next hospital where they will upload it. They'll scan it and upload it into their EHR. And I'm like, have you guys heard of care quality, Commonwealth, because you are absolutely connected in the back end. The frontline folks are like, I have no idea what you're talking about. That would be awesome, that kind of system, right? So we still have a lot of work to do to say, how do we make that the organization instinct of every frontline person to say, yes, it's electronic, it's just going to go, and I don't even have to think about it, rather than still resorting to, yes, let's fax, let's scan, let's hand it to the patient.
And that was in Boston, I assume? Was that?
It was outside of Boston.
Yeah.
Yep.
Yeah, that's tough to see with all the work that we've done in the past 10, 15, 20 years on that.
Yep.
So, looking forward a little bit this year, what are some of the priorities that you and the ONC team will be working on? Also, you want us to, kind of help and support as well.
Yeah. So, let me dive deeper into the areas that I just talked about. So, building that digital foundation. We have a tremendous foundation that we've built over a relatively short period of time, roughly 10 years, transformed an industry from something like 10% adoption of electronic health records to 97% of hospitals, as reflected in that brief, and over 80% of ambulatory providers now using not just electronic health records, but certified electronic health records.
Right.
I would dare say you could not look at any other sector of an economy as complex as ours and see that kind of transformation in the use of technology down at the ground level in such a short period of time. I mean, I just don't even know of another example. So that's been tremendous. But we still need to fill in those gaps. Data standards. Quality of data is still an issue. We're exchanging more data, and that's just exposing that people aren't using standards. And now I've got all this dirty data, all that that I can't make sense of. So we're pushing really hard in the U.S. core data for interoperability, working with federal partners on having them base their programs on the U.S. core data for interoperability. We're working hard with our federal agencies partners on how can we exercise our levers to help fill in the gaps. Behavioral health, big priority for the administration as well as for the Congress. LTPAC, another huge area that didn't get the benefit of those incentives.
Right.
How do we work with our federal agency partners to say, well, each of our programs is sort of small, and it's certainly not $35 billion, but if we're all rowing in the same direction, we actually might be able to provide more resources to those organizations to allow them to make judicious incremental investments in health IT that would really benefit what it is they're doing. Third is really pushing hard on APIs, both with ONC. Standardized EHR, certified EHR developers required December 31st, 2022 to make available a FHIR R4 standard API to all of their customers for whatever purpose the customer wants. And importantly, and most people, people often lose sight of this, CMS rolling out in their rules that payers are required to make available information to their members, to providers, and to other payers using the same standard FHIR R4 API that ONC has approved and certified for electronic health record vendors. So you start to see the building, this constellation of APIs based on this standard, open industry standard, using all the federal levers that we have. TEFCA is the other layer on that. We're pushing really hard on network interoperability. I think Didi probably touched on that a little bit. That's about, sort of document exchange as it's supported today. But importantly, and I think where the future is going, is network infrastructure to support FHIR APIs to connect with each other. So we don't need to broker a transaction between two FHIR APIs. God intended APIs to connect with each other directly. That's okay. But the issue is, how do I know the electronic endpoints of the 33 organizations I want to connect to? How do I know that they're playing by the same rules? So we have some contractual agreement. How do I know that they have security protocols in place and that we have secure transmission, between our organizations? That's what FHIR network infrastructure, or a TEFCA network infrastructure can support, what I call trust services. So I'm a FHIR API, with a payer. I can look up, here are the 15 provider organizations who I want to be able to connect to and get data from. There are their electronic endpoints, fire off my APIs, get the data in a very scalable way. And then finally, appropriate use of data. Health equity by design, key administration priority. How do we get better and more consistent capture of health equity data to be able to use it in more effective ways to mitigate some of the health equity issues that we see out in the market? And then importantly, algorithms. Everyone's talking about algorithms. And algorithms are really important in healthcare, but we need some kind of process for saying, how do we determine what's an appropriate use of an algorithm in any particular setting? How do we get better data to create higher quality algorithms, right? Dirty data is going to create a dirty algorithm.
Got it.
And that's one of the big issues that we have. So these things are connected. And then finally, we've all got big privacy issues that we have to tackle. Think about the issues that are going on with the weaponization of data that is shared among providers for care purposes. But in the post-op world, that can be used against the patient and against the provider in ways that they may not anticipate. In that ways that lots of us in the industry didn't anticipate. So another focus area for all of us in the administration.
Excellent point. So for people to learn, a lot of my show, we focus on best practices, but also tangible next steps, actionable next steps. Where would you point them? Is it healthit.gov to begin to learn more about what your office is doing and how they can involve and where they can volunteer?
Absolutely. Yeah. So a number of things. Healthit.gov, we have listservs. Our blog, we've pushed really hard to communicate better. So one of the things that I've done since I came in is we publish a blog a week.
Yeah. It's awesome.
A blog a week. You're going to get a blog a week. So you subscribe to that. It'll get pushed to you. And we try to communicate everything
Very
about what we're
simply, too.
doing
Yeah.
externally, internally. And so then there's a ton of stuff on healthit.gov about information blocking and others. I would also point to the Sequoia project, the RCE website, which is a great resource for learning about TEFCA and all the information that's available there. And then finally, call us. Email us. You haven't called in so long. My email is micky.tripathi@hhs.gov. We will always set up a meeting with stakeholders, and we're always, happy to help educate you on what we're doing. But most important to us, learn about how we can help you better support what it is we're all trying to accomplish in healthcare.
Yeah, and I'll actually second that. You guys, I mean, I've been working in partnership with ONC for, I guess, 20 years now or so, Dr. David Brewer days. But you guys have always had open doors, always listen, always, are pragmatic with us in the industry, and just are phenomenal collaborators between the public and private collaboration. So your office is fantastic. Steve and the whole team. I saw Jody Daniels actually yesterday. It was really cool. Some from you back in the day. But you guys have a great office. You run a great ship, and I appreciate you and all your time that you invest.
Great. Thanks
Micky
so much.
Tripathi, thank you so much.
Really fun
Appreciate
being
it.
here.
Thanks, Micky. Pass. All right, Mr. Dorner. Interoperability. Let's keep it going. You're my fourth guest for interoperability. How are you?
Good. How you doing?
Fantastic. Mark Dorner, CEO of PreciseMDX. Actually, in the lab space, Micky brought up how the lab space is a focus now for Sequoia project and what they're doing. So we'll dive in here in a moment. But first of all, how's ViVE been for you, my friend?
I mean, the show is great. Feels like it gets bigger every year.
It does. 50% larger, I just heard.
Yeah, I was going to say, I really like the diversity and the kind of innovation you see on the floor. Lots of different companies every time. It's really great. Yeah, for us personally, it's a success. We have our corner of the healthcare space, which is lab, but there's an ecosystem behind us, and seeing the different companies and how they can support our mission is phenomenal.
Yeah, and I always like to have you on my show because you kind of saw the importance of the lab space before almost anybody else did. So your unique perspective. And then, of course, Didi brings up, the importance of lab. And I'm like, oh, my gosh, finally, someone's talking about it outside of you, which is great. But first of all, what are you seeing? I mean, we obviously talk about lab, but what are some of the healthcare, digital health trends that you're seeing in the industry right now?
So it's very interesting. I like that I'm on the interoperability show.
Yes,
like your last three guests. And we all know that interoperability is key in healthcare, data sharing, and it's hard.
Yeah.
And your guests are attacking it in very beneficial ways to try to solve the problem.
Got it.
I see a lot of trends that focus on consumerism and coming at it from the patient side, hoping the patients will demand better access to their information in different ways in different segments of healthcare. So it seems like that's a big trend, just the consumerism and the empowerment of patients and their ability to both demand access to care and have access to their information.
Fantastic. Access to information. Love it. So what are a few best practices, 2 or 3 best practices or strategies that you'll share to help others navigate these trends?
So I'm not going to talk too much about interoperability, but the consumerism side is important, and most organizations in healthcare are busy and also have lots of priorities. And sometimes they get a little complacent about things, as saying, well, when it comes, we'll deal with it.
Right.
Interoperability is a great thing. Your other guests are building these networks to share information. Unless they have a clear strategy in place to access these networks, they don't have to implement it right away, but they do need to be thoughtful about it.
Absolutely.
And prioritize it. And consumerism is part of that too, and the sharing of information and how consumers are now demanding care post-pandemic and what they expect and what they want. And as you know, in healthcare, change doesn't happen quickly. It's a combination of setting policies, then applying incentives, and then getting penalties, and also demand. It can come from the provider side, the government, or consumers. So I think that's important. And, really also, whatever priorities you set in strategies, measure them. Set your key success factors saying, we're implementing this policy. This is how we're going to approach it. How do we know if we're being successful? How do we measure it? Dr. Micky, had a great thing. He said, interoperability is up. So he knows that they're doing a good job because things are getting better.
They're slowly moving. They are moving.
Yeah.
Yep. So thinking ahead a couple years, 3 to 5 years, what's a trend or something that we need to be able to successfully navigate? Kind of let people know where the future, we're going to that proverbial crystal ball, I say.
Yeah. Well, I think, all the interoperability is a long process for change, and you have to kind of come up with solutions to bridge the gaps until you can get to that point. So I think looking at other industries on how they deal with consumers and in healthcare, the patient is the end customer.
Right.
You have people who order things, and then you have the patient who actually gets the treatment and the care. And being mindful of consumers and their behavior, looking at other industries like retail or even digital gaming, and understanding how they engage consumers and get them, empower them, and want them to be part of the journey. Right. So if people are in digital gaming, they get engaged and they are actively participating. Is that us? No. In their journey there. You want patients to be the same in healthcare, not just when they're have a chronic or acute condition, but kind of on an ongoing basis. I was in a meeting yesterday and we were joking a little bit about the fact that I go every year and get my annual wellness visit and get my blood work, and I'm healthy, thank God, but I just like to know what's going on.
Right.
And I was talking to some of my colleagues who are quite intelligent. They're like, I don't go to the doctor, I'm not sick.
Right.
That's a bad thing to hear, right?
Very true.
You don't want to get there when it's too late.
So we talked a lot of the thought leader stuff. I gave Aneesh time to talk about CareJourney. I'm going to give you a second. I got about 2 minutes or 2.5 minutes. Tell us about PreciseMDX, what you've been doing, how you've been building that company, and what's next for Precise.
Okay. Yeah. So I've been in the healthcare for a few decades, and in different
that old?
aspects. Yeah, I'm pretty old, at least 6 months older than you. And we've done a lot of platforms and solutions using technology to enable change and empower patients, empower providers. We, a few years ago, focused on the lab space, seeing it's a very large part of the healthcare industry. I think it's a CDC quote, 70% of medical decision making is based on labs, which makes sense. You go to the doctor, you don't feel good, they run some tests. Mm-hmm. So our mission was to make that better, to enable better access, to enable better connectivity. And we're going about it in a few very creative ways. Just connecting, whoever's ordering the tests to the laboratories, making the patient part of the journey. And that's our mission and what we're continuing to do. I think when you talk about interoperability, you have sharing of information, right? Where that's very important so people can share medical records. But you also have another aspect is when a care provider is ordering a test or a service, and it goes a little bit beyond sharing. It's not just, here's my data, there's more to it. And there's more information. So that's another level of and layer of challenge in interoperability. So we're focused on that and really helping labs grow and thrive.
Love it. And Didi brought up Shield, which is I'm going to look at Shield when I get off stage. But really, I guess there's a focus there on data standards, I assume, for interoperability of a lab. So that's certainly a great place to begin to look as well. What do you hope to get out of your remaining time here at ViVE?
So, we have our corner of healthcare, which is the lab space, but like most things in healthcare, you can't do everything by yourself. We have an ecosystem of partners and companies behind us. And, walking the floor and meeting, existing channel partners, customers, and new companies, we just expand our ecosystem. A great example is we saw a very innovative company that are using pharmacies to do specimen collection in underserved areas because, people need access to care. There's pharmacies everywhere. They have trained technicians who can take samples and specimens. So that's a great partner for us to enable our labs to extend their reach into underserved areas and, have better access for the patients.
Do you know where ViVE's going to be in 2024?
Is that the International ViVE in Amsterdam or the one in LA?
LA.
Yes.
Good job.
Yeah, less of a flight for me.
I just saw that for the first time walking in. I'm like, oh my gosh, LA. That'll be a fun trip.
Yeah, I actually looking forward to the one in Amsterdam too because I used to live there. So it's a good excuse to go back and visit.
I completely agree. Mark Dorner, CEO of PreciseMDX, thank you for joining me on the show and welcome back again.
Thank you, Justin. Appreciate it.
Have a great rest of your conference. Thank you. Kathryn Bingham, VP of Interoperability, eHealth Exchange. So welcome to the show.
Thank you very much. It's great to be here.
First of all, how's the conference been for you so far?
Oh, it's been great. It's really interesting to see all the different companies out there and to see the new technologies that are coming out. I've been very impressed with the presentations, so it's been very fun.
What's your goal for the conference?
Well, with the eHealth Exchange, we are exhibiting at HIMSS. We thought this would be a great place for us to exhibit next year, and just wanted to get a sense for what kind of audience it was. So that's a main goal, but it's also connecting with the people that we partner with, as well as seeing what other technologies and what other companies we might be able to connect with in the future to promote interoperability.
Absolutely. I mean, literally, this was not supposed to be an interoperability show, but every single one of my guests today has all been talking about interoperability. So, and obviously it's key. It's near and dear to my heart for the past 20 years. So I love it. In February, eHealth Exchange was announced by HHS as one of the 6 initial candidates for the QHINs, but Qualified Health Information Networks under TEFCA. So tell me about that process and, the briefing and the entities agreed to push for onboarding by the end of 2023. Is that possible?
Right. Well, we're really excited about that, and excited to be part of the first 6 that are have our applications approved. Yep. This journey started much, much earlier, and we at the Health Exchange have been preparing for this for years. Absolutely. And last year, when we got the first SOPs from the RCE, we really pushed hard to look at our technology stack and make sure that we were prepared for this. And we came up with a great deal of detail on the changes that we need to make, as well as our participants might need to make to be able to be prepared for this. We're excited with the other potential QHINs, mm-hmm. and it's dependent on all of us, but none of us can be a QHIN without another one being a QHIN. That's right. So we have to work together to make that happen. And we're hoping to start the testing phase any day now, and we're ready to go. I think the end of the year is still possible. It's dependent on the RCE. It's dependent on the other QHINs, mm-hmm. but we're ready to go. And so we've done our internal testing, and we're confident that we're going to be able to make it.
What are some of the, explain some of the processes specifically that you have to go through?
Well, you have to do all the testing that between the QHINs, and there's content testing. And the eHealth Exchange has done content testing, one of the few networks that does that. And so we're used to that process, and it's a very similar process to what goes on with our participants. We have a separate environment for the QHIN, because not all of our participants have to participate in the QHIN, and so we have a separate process for that. And we sent out just recently, what each of our participants need to do to be prepared. And so we have some that have said, no, I'm not going to opt in yet. We're going to wait because this looks like it's going to be hard work, and they don't have to join right away. And some will wait till we're further down the path and there's additional use cases that are promoted through the QHINs.
So, in kind of even in that direction, what should a hospital organization be doing right now as they plan for participation in TEFCA?
Well, they need to look at it from the perspective of, what value is that going to gain them out of the gate? And, there's additional players that they'll be able to connect with. And I think that's one of the big things. We have right now within the Health Exchange, we cover 75% of all hospitals in the United States, 85% of all dialysis clinics, and 61 regional and state HIEs. So we have a great deal of connectivity, but wouldn't it be wonderful to connect with the rest of those organizations? And that's where I think the QHIN to QHIN participation is going to add a lot of value.
Agree. So what are some of the best practices, I guess, if you're a hospital CIO, a board of a health system, or even the executive suite, what are some tangible next steps that you would advise, offer to them, say, hey, this is how you can engage. This is how you can kind of take some steps in the next direction. It could be intimidating to some. There's a lot of priorities for these health systems. What would you recommend they do next? What's a good first step?
Well, making sure that you're aware of what's happening with TEFCA, and making sure that, you're using the resources that we and the other potential QHINs would provide, and preparing for it, because it is not for the faint of heart. There's work to be done. So, getting started on that, and then, it's only going to be good for everyone if people move to those standards that are promoted by the RCE and TEFCA.
Excellent. So if someone wanted to go learn more and something tangible, where would you point them to? Is there a website, a work group, or a combination of different things that you could point somebody to learn more?
Sure. Our website, we're extremely transparent. Everything's on our website. We have all our technical standards, all of our pricing. We are here to promote interoperability. And so our TEFCA section right now on our website is pretty thorough. But it also, we are expanding that, and we're going to be putting in all the technical standards that people need to change and need to be up to. So we'll be putting that out to the public as well, and that should be coming out this week. And so it's the eHealthExchange.org is our website, and there's a big banner that says TEFCA. Click there, and you've got it.
And I assume there's a work group of people, because I'm a big proponent and encourager of people joining work groups, learning from their peers, reaching out when they have questions, and us as a community trying to solve these problems together. Is there a consortium or a work group or someone that you could point someone to where they could kind of learn more?
Sure. We have a technical work group that meets every Thursday at 1 o'clock. I think it's 2 o'clock. 2 o'clock Eastern, and so that's a great place to start, and that is open to the public. You don't have to be a participant with the eHealth Exchange. And then we are doing webinars and office hours for our participants.
Excellent. Love it. Kathryn Bingham, thank you so much for joining me today on air, and congratulations, and keep up all the great work. We appreciate it.
Thank you so much.
Thank you, Kathryn. Appreciate eHealth Exchange. And just want to say thank you very much to Roberta and Carol and Greg and the whole team at Healthcare Now Radio and CHIME and DHI for letting us use the stage. Thank you to everyone who's joining us here in the audience, and obviously everybody listening online. What a great show. I didn't realize that the entire Thought Leader Hour would be all interoperability, but it worked out great. As I mentioned, it's near and dear to my heart. What a great lineup. So Roberta and Carol, thank you so much for making this all happen as well. And I'm Justin Barnes. Thank you for tuning in, and we'll broadcast again live tomorrow for the special episode of This Just In Radio.